All right, captioning test 1, 2, 3. Test 1, 2, 3. Good morning, I'm Dawn Jeffries, and I will be moderating today's President's Town Hall with Virginia Tech President Tim Sands. I'm joining you from my home, which is why I'm wearing our mask, as our panelists. They're in their Zoom boxes in their own personal locations and physically distanced. Please feel free to take your masks off to our panelists. Thank you for having them. This is our norm now, as many of you know, it's our default, and we just do this to remind you and encourage you to wear your masks or face coverings when you are not able to physically distance. Thank you again to our panelists. Thank you to everyone joining us. As always, we are recording this session. It will be available on YouTube immediately after we wrap up today. I'd like to introduce our panelists joining us today. President Tim Sands, of course, Blacksburg Mayor Leslie Hager-Smith, and New River Health District Director, Dr. Noelle Bissell. This morning, we are going to focus on talking about our community, especially as we are entering almost week 2 of the return of students and the start of the fall semester. President Sands, I'll just start with you, and if I can just ask you, if you can just talk about this last week in which students returned to campus for the start of fall. Talk about the excitement, but also tell us about the concern over the ongoing pandemic that we're managing and working through.
Well, thank you, Dawn. First of all, I'm really happy to have this opportunity to be with Mayor Hager-Smith and Dr. Bissell. You know, this isn't the only time we see each other. We're in constant communication. Our teams have been working together throughout this whole pandemic, and that partnership is, I think, the key to our success so far, and our confidence that we're going to get through this in good shape. The students are just wonderful to see back. They're wearing masks, they're distancing, they're out and about, and you can tell that there's a lot of energy around being back on campus, despite the fact that everything is a bit constrained. The experience isn't what any university student would wish, but it is really special to see everybody back enjoying the things that can't be replicated online. You know, back in the spring, we were forced to go remote, and that really established the contrast between what we can do remotely and what we can't. And we're back. Our research programs are up and running again. We've got students are able to meet via Zoom, and if they're outside, they're able to get together with masks and distanced. So it's going quite well, I think. Now the challenges around the pandemic are really concerning, and there's no question that it's all hands on deck to do our best to push this down and to get through the opening few weeks. But I am encouraged, and it's wonderful to see the campus and the town back to life.
Great, thank you, President Sands. Moving into our questions, I first wanted to talk about the campus dashboard. It was updated this week and reflected 157 new cases over the last week. Can you put that in perspective for us? I've heard you say before, and Dr. Bissell, talking about this not being unexpected. President Sands, I'll ask you. I can also start with Dr. Bissell if you'd like, but want to hear from both of you.
Go ahead, Dr. Bissell.
Oh, yes, thank you for having me in this discussion. And I think we really do have to continue to highlight our partnership and the epidemiology of this pandemic. This disease is transmitted in places of higher population density. So it's not unexpected that when we bring a large population back to our community, that we will see increasing transmission. So we fully expected to see an increase in cases. The good news is that for the most part, overwhelmingly, our students are very cooperative with what has been a complete topsy-turvy ride in what their traditional college experience was, what they were expecting. And they are embracing the change and the fact that individually they can contribute to how things are going, and they can make a difference in keeping our entire community safe. The students are part of our entire community. So a rise in cases, we know how this disease is spread. We know that it is through close social connection. So we have people coming into more dense living settings and some more socialization. So it's not at all unexpected that we would see a rise in cases. And we did predict this, and we do expect that the cases go up over the first couple of weeks, and then they will start to trend down. We do have some experience with Radford being slightly ahead of Virginia Tech, that they started coming back to campus sooner. And that's exactly what we have seen. The cases did start to go up, and they went up significantly, but they are starting to trail off just as significantly now.
Yeah, I would just add that, thank you. I would add that our dashboard, which is still under construction, if you will, we've been updating weekly, and we'll shift to next week to daily updates. It shows about, if you look at the current numbers, about 1% of our student population has tested positive. And that's certainly more than we would like, but not unexpected, as Dr. Bissell said. If you look around the country, we're seeing the similar situations at most universities. We're fortunate, I think, in our plan. Our plan, I believe, is holding up very, very well. Everything from contact tracing, which is the responsibility of the New River Health District under Dr. Bissell's direction, and the partnership with the community, which Mayor Hager-Smith represents. That was established, those partnerships were established months ago, and we're seeing the benefit of that now as our plan moves forward. One of the things I'd like to emphasize is that you'll see us continuing to adjust. We're adjusting everything that we do as we learn more. And as Dr. Bissell mentioned, the experience at Radford, where they're a little bit ahead of us, is really helping us. I was just speaking to the president of Radford a couple of minutes ago and just getting a weekly update from him. And everything that they saw a week ago, we're seeing now. Almost every move that they made a week ago, we're doing now. And I'm hopeful in the sense that the trends are good.
A number of questions. I think the majority of the questions that were submitted are about contact tracing. And Dr. Bissell, if I can go to you again, can you explain how the Department of Health is handling that for Virginia Tech? And the second part of that is, who exactly gets notified?
So everything starts with a positive case. The health department gets notified of a positive case. Every case is interviewed, and during that interview, we ask about close contacts. We ask about the risk behaviors and the situation, and we make a risk assessment. And from there, we determine close contacts and go to who needs to be quarantined, who we need to test, and obviously our index case will go on to isolation. But that risk assessment is key, and I'll say that obviously our students, they're keeping it amongst themselves. And again, we've learned this from Radford, and we're seeing it with our Virginia Tech students. In general, they tend to be a very low risk population. They're not getting sick, to some of them, or a lot of them, having no symptoms at all. And their contacts are generally other students. So those case investigations are a little bit bit different than a higher risk where that student might intersect with our community or our higher risk and more vulnerable population. From the get-go in this pandemic, it was very clear that we had to protect our most vulnerable populations. And that's in every interview we do, we look for those connections. But what we are seeing overwhelmingly in Radford and in the Virginia Tech community now is the students keep it to themselves, and then our community cases are separate. We are not seeing any kind of a linkage there. Our students are tied to students, our community members are tied to community members. We are not seeing any cases that we cannot in the community trace, which would be a red flag. And again, we're not seeing the people getting really sick. So every case is different, but it always starts with the positive case and then the risk assessment and where we go from there.
Great, thank you. President Sands, another question that's quite common and being asked is what it will take for the university to go fully online. And people seem to be asking this as if it's going to happen in just a matter of when. And I just wanted to ask you, is that the case? It's my understanding that it's not just about the numbers. What indicators are you monitoring and why?
Yeah, thank you. That is a question we get all the time, and it's really an important question. The indicators that we published back in July, which you can find on the VT.edu site in our contingency plans, and also on the SHEV, the State Council for Higher Education Virginia site, are still the ones we're looking at. We're looking at, do we have the quarantine and isolation space on campus that we need? Are the infections spreading into the community, which you just heard Dr. Bissell say that at this point that's not happening? Are we protecting our most vulnerable? We also look at and talk frequently with our hospitals in the region, both in Montgomery County and in Roanoke, just to understand, are they seeing anything in their ICUs or in their hospitalizations that might be tied to Virginia Tech? So far, no. We have, if you look at the VDH dashboard, you see something like 16 COVID-related hospitalizations since the beginning of the pandemic in Montgomery County. And that number hasn't changed in the last couple of weeks. So, so far, so good. That's a lagging indicator, but we look at that. It's a very complex picture going forward. Now, in terms of changes that we might make, it's hard to imagine all hypotheticals and understand the whole context. One of the things that we look at is relative risks and relative trends. It's really important to take into account the big picture, not just what's happening in our little bubble, but what's happening around Virginia and around the country. So at this point, we are not contemplating any change in mode of operation. We're trying to continue working with the principle that it's really about the willing, in the sense that our faculty and instructors are able to choose the mode they operate in. And we're trying to be as flexible as possible with our students and to make sure that they're comfortable in the mode that they're operating. And I think that flexibility is key. There are lots of things that we're learning from around the country at other institutions. The issue of, does it make sense to go all online? That may make sense in some cases, but we know that our students, for the most part, will stay in town. A lot of them will. And if we don't have them, for example, in the residence halls, then we don't have the protective capabilities that we do when they're here on campus. They wouldn't be subject to our contact tracing, our testing, and all the other things that we bring to the congregate settings that we have on campus. So it's a complex decision, and we track all of these metrics that we have published. We look at them really every day and make a decision about whether we're in a good place or not. Do we have to make a change? So right now we don't contemplate any changes, but we are watching carefully and working with Dr. Bissell and Mayor Hager-Smith and all of our community members to monitor the progress of the pandemic. And we will make changes if we need to. We'll let everybody know well ahead. But right now, I think we're on track, and we'll stay on that track until we have information that suggests that we need to change.
Dawn, could I add a little something to that?
Absolutely, Mayor Hager-Smith.
Yeah, I think what I would like to add to that is to explain what I feel confidence in the decisions made so far. We did start months ago, it was back in March, when a group of people from the New River Valley convened. It started out as just a county public health task force, but it quickly became region-wide based on the strength and the vitality of the efforts that took place. So this now includes 4 counties and the city of Radford, all the first responders, social services, also mental health professionals. And we've been working together all through late spring and all through the summer to bring all the best practices that we can to this process. Our town and county managers meet every week by phone. The town council in Blacksburg just got a report out from those hospital administrators on Tuesday this week. And we learned about their capacity, which is fine right now. As our chief says, that really is the governor on the machine that we've built to keep everyone safe. So capacity is fine right now, but if they needed to increase hospital capacity, they could by 50% by eliminating elective surgeries again. And that's where we were in the spring. So the level of communication that's taking place and the amount of expertise in the room when we get together is very, very helpful. And I want to disabuse people of the idea that the university is working unilaterally, that these are monolithic decisions. This is an extraordinary team effort that is unprecedented in our region. And it has been so successful to date that the Virginia Department of Emergency Management has cited us as an exemplar for how these things should be done.
If I could add an example, and I know it's one that's disappointing to many, but we did spend some time together over the last several weeks on the issue of tailgating. And it doesn't make sense for Virginia Tech to put on restrictions and not to have a parallel set of expectations in town, or vice versa. So I think that's a great example. Difficult decision. Fall football tailgating is part of what it means to be at a college campus, especially one that has a big football program. The town depends on football to a large extent, but the tailgating was just a step too far. And again, difficult decision, but one that we made jointly. And I appreciate the understanding that the community has. And when I say community, I mean the bigger Hokie nation that's spread all over this region, that this is just not the year that gathering and tailgates, it makes any sense. We will get back to it someday soon.
That's right. And I'm mindful of something I've heard Noelle say many times, and that is we've had adult outbreaks as well as student outbreaks. If we expect the students not to party, the adults need to do as well as the students are doing.
And I'll
Go ahead.
Well, again, it's the epidemiology of the pandemic, and our goal from the beginning was to protect our communities, and the students are a big part of our community. I will say that the university has a very comprehensive safety plan in place as far as the distancing, as far as the hygiene, as far as the masking when they are on campus in the classrooms and partaking in that experiential learning, which is so important in their college experience. So what we are seeing just across the nation with schools, both institutes of higher education and in the K through 12 schools, is you aren't seeing that transmission in that setting. You may find someone who is positive who then shows up in school, but it's not that the transmission was there. And I think that's very important to note, because again, we know how this is transmitted, and it's in the social settings. So the classroom, the learning sessions, the labs, and the discussion groups, they're all practicing very safe precautions. And those basic public health infection prevention precautions can go a long way to stopping the spread.
Thank you. And I wanted to go back to tailgating for a little bit, because that is something that really gets to the heart of a lot of the questions that are being asked, because it is President Sands, as you mentioned, a beloved tradition here. And Mayor Hager-Smith and President Sands, can you talk about tailgating a little bit more and talk about I know you talked about why that decision was made, but some of the requirements and enforcement actually, and how the town and Virginia Tech community are going to ensure that folks don't continue to tailgate and as opposed to home gating or whatever the catchphrase is for that now.
Tim, do you want to go first?
I'll let you go first on that one.
Okay. We are fully prepared to enforce the laws that are in fact in place ordinarily. There are ABC laws that govern the idea that people shouldn't be drinking in public. We all know that during football weekends, we sort of turn a blind eye to some of that because we do value the tradition and football and the university just as all community members do. But this is a situation where we need to enforce the laws that were put there to keep us all safe and to keep stability. And so we will be enforcing ABC laws. And in addition, the town council has invoked its emergency powers. We passed something called Ordinance 1942 a short while ago, and that requires face masks and it requires social distancing, and it limits the size of gatherings. Now, the university has recently limited a desirable size of gathering to 15, and we're happy to stay in accord with them. And that has been one of the strengths of our response so far, is that we are sharing the same messaging and the same mentality and the same wish for success.
Yeah, and I just add that the Virginia Tech Police will be monitoring the parking lots and letting people know that we're not tailgating if they didn't get the message, in parallel with what you'll see in Blacksburg. And again, I mean, it's just a hard thing to do because we really enjoy that, getting together and celebrating a great Saturday afternoon and going to the game. But it just is going to be different this year. I think if we're really careful and diligent, we'll get through this in a few weeks in terms of the peak, and in a few months we should be able to put this behind us. Hopefully by the time we get to next fall, none of this will be an issue, but we've got to stay with it, otherwise it's just going to linger. And I think the tailgating is something we can forego for a year. I would like to say though that you know, I know a lot of people will move inside, and that's fine, but stay with your pod, stay with your family group. Don't broaden it. And again, it's a short term, it's just one season, but it's really important that we stick to this to avoid the spread of the disease further as a result of indoor gatherings, especially without masks. And that's where we see the biggest challenges. And I'd maybe add to that if you think back on what we knew about the virus and the disease back in the March timeframe, we know so much more now about how it's transmitted, who's vulnerable. We don't have all the answers, and Dr. Bissell knows more than I do about this, but I really feel like we know too much now to be irresponsible and to ignore what is just obvious from the science and from the epidemiology of COVID-19 and the SARS-CoV-2 virus.
President Sands, I wanted to go back to something we were talking about a little bit earlier. We've talked about this not being about the numbers, but I do want to ask you to talk about the numbers for a little bit in terms of the dashboard, because a lot of people look at that, and you guys have given us great context around those numbers and what the expectations are and how epidemiology basically works. But I wanted to ask you specifically about the dashboard. We know moving forward, it will be updated more frequently. Can you explain what that actually means in terms of frequency, and also how that information is collected and how we should look at that?
Yeah, it's. I think there's probably, and Dr. Bissell could maybe elaborate on this, but there's probably a little bit too much attention to numbers of cases. That's something that is important, but it's not the main metric that we use to judge how we're handling the pandemic. It has more to do with, as she was saying, is the disease moving from one segment of our population to another? And are we protecting the most vulnerable? That's not to diminish the seriousness of the disease for even the 18 to 25-year-old, but it is, from a practical standpoint, probably not the best number, but it is where the focus is. And what we are doing with the dashboard is we're working through the data integrity and data definition issues so that we can go to a once a day update and use a 7-day moving average so that people can track where the positivity rate is and where the number of cases, the new cases per day or per week settles. And I think you'll see that there's plenty of information on there. It's certainly beyond the level of actionable information, I believe, but it's important to be transparent. And what you'll see this past week, we had 157 new cases. This week, the week's not over, but I suspect it'll be at least that, probably on the order of a few hundred new cases. We're still in the range where we thought we would be. The key is, will we see that plateauing over the next couple of weeks and then trending down? And that's where we get some, I think, some hope from what we're seeing, some confidence in our plan at Radford being about a week ahead, and then starting to see plateauing and even dropping in the total number of new cases. But we'll also have the number of students in on-campus isolation and quarantine space, which is something we track carefully. We'll have, you'll see the testing, the pre-testing broken out. And I just remind everyone that we tested everyone who is going to be living on campus, and the positivity rate was on the order of 0.25%. And that gave us confidence that that the students moving onto campus were starting with a clean slate. But as Noelle will tell you, a one-day test has meaning, but it doesn't have lasting meaning. It's just a snapshot. But it did, I think, show us that our incoming students were listening to the messages about quarantining before they came, about watching for symptoms and being careful, and that makes us feel quite good. But you're going to see a transition toward different kinds of testing, and much of our testing that we do at the Roanoke site and molecular diagnostics lab is actually applied by our regional health districts to deal with outbreaks in our expanded communities in the western half of Virginia. But a portion of that, roughly half or so, is dedicated to Virginia Tech students and employees. And you'll see that broken out. You'll see changes from week to week as we change our testing profile from surveillance of the incoming students to monitoring of symptomatic students and staff, looking for essentially high-risk situations where contact tracing reveals a significant contact, where a student or a faculty member is in a high contact role, they'll be prioritized for testing. So you'll see some gradual evolution in those numbers in terms of the numbers of cases, the positivity. But I hope that it's helpful to the community. But I do ask that everybody if you're going to use those numbers, become a student of them, learn a little bit about what they actually mean. And with the help of our New River Health District and Dr. Noelle Bissell's staff, we'll make sure that we keep pushing out the information, the context of what you're seeing there. But you'll definitely see an uptick, and I suspect that'll continue for a while, and then we'll be watching carefully for that plateau that would reflect the what we believe is the case on the ground, that our students and our faculty and our staff and our community members are heeding the advice and are actually going to be able to turn this around rather quickly.
Dr. Bissell, would you like to add anything?
Yeah, so just a couple of things, talking about testing in general. Certainly the ideal situation would be unlimited testing very frequently. And that actually is evolving. Testing has changed from the beginning of this pandemic. Of course, the test we talk about right now is the molecular test, which is very, very sensitive, meaning that you have a low risk of getting a false negative. That picks up actually the virus itself. There's the antigen test, which also looks for active infection. That's a little bit less sensitive, but still doing very well. We use that at the health district. and it's a more rapid test to give us an answer, and that picks up the proteins on the surface. And we're looking at ways that we can do even perhaps less sensitive testing, but more frequently. And that, quite frankly, is really more important during the pandemic, to pick up, to more broadly screen. However, right now, what we have to do is we have to look at our resources, and we have to make sure we prioritize those resources so that we are doing the best we can do. And right now, the key is to be able to get those folks who are positive into isolation and get their contacts into quarantine, so that they, getting those positives on those high risk individuals is really important. And as Dr. Sands said, those high risk contact individuals and those symptomatic individuals are very important, because not everything that is a cold or flu type thing or a headache or a stomach type bug is COVID. So we're trying to track that in real time and make those decisions about containment and mitigation based on that testing. But hopefully this fall, there will be some at-home testing that's rolling out. OraSure, which does the at-home HIV testing, has a platform that they're very soon going to be applying for authorization. And that really is the answer as far as testing, that people can do this at home. And if it's positive, they stay home. If it's negative, they can continue to go to school, go to work, or whatever. So you will see a lot of things evolve in testing over the coming months. And, this is not unusual. We're learning as we go. We're developing new technology as we go. And people have to understand that things changing is actually a good thing, because we're learning more and we're able to apply the mitigation and containment strategies better, as they do change. I'll also talk about the positivity rate. People use that a lot. And like Dr. Sands said, we have to look at the numbers and keep them in perspective. Fralin has been integral to our response here. And over the entire summer, as we were, participating in, beefing up their capacity, knowing that they were really going to be tested as the students came back with their capacity, we did very broad community testing. Anyone who wanted a test, asymptomatic or not, high risk or not, got a test. And the results from that testing overwhelmingly showed that people with very low risk behaviors and very low risk of exposure, symptomatic or not, were negative. People talk a lot about asymptomatic carriage, and there's definitely asymptomatic carriage, especially in our younger populations. But again, the asymptomatic positives that we see are the individuals who have high risk contacts or high risk exposures. So, as you focus more on those people, your percent positivity will go up by nature that you're testing a higher risk population. So it's not unexpected that that number will go up. And we have to keep that in mind as we navigate this. As far as the numbers on the dashboard, the biggest numbers, the most important numbers are your on-campus numbers, for reasons that Dr. Sands already discussed. The isolation and quarantine space, they are congregate settings with the dorms. So they are very, very important. And we focus a lot of time on those investigations because we have to contain and mitigate those numbers. Our off-campus students, they're adults. They live out in the community and they have rights to privacy as well. So we're much more reserved about disclosing those numbers. Again, as the mayor said, everybody's behaviors matter and they're part of our community, and we're holding all of our community accountable for their behaviors individually. We don't separate Blacksburg and Christiansburg. We don't separate one neighborhood for another one. So we have to be very careful about that. As we report those numbers, because we have to respect privacy even in a pandemic. And I think people tend to want to know more information than they really need. I mean, I'll get people saying, I need to know if it's students because I want to avoid those stores where they shop. And quite frankly, if we all practice those same behaviors, we're going to protect ourselves and protect our community. And disclosing who or where our positive cases are does nothing to give them a message that we're not already giving them. So if it is not going to impact public health, we lean to not disclosing.
If I could add a little update on the molecular diagnostics lab at Fralin, under the leadership of Carla Finkelstein and Mike Friedlander and their teams. Their capacity is about 1,000 PCR tests per day. They recently got EUA, an emergency use authorization from the FDA for mid-nasal. They just got it for pool testing, and they're applying for saliva-based testing. And Noelle and her team have helped with that in terms of collecting those samples necessary to validate that test. But they're also working on other tests that are faster. And of course, the commercial market is doing the same. And so I'm confident that our testing capability will get better and better. It's not going to go down. It's going to get better every week. The other point I'd like to make, though, and I should also mention that we're moving toward wastewater sentinel testing. That seems to be working around the country. It's more of an experiment at this stage, but it's kind of interesting, and we're looking forward to seeing how that works for us. We've got a great team, the COVID modeling team that reports to the provost frequently. They're doing wonderful work in terms of epidemiological modeling, giving us insight into, well, if we change this, will we get more information? Will this be valuable or actionable? So that group has proven to be exceptional and a really great talent from around the university helping on that. But one point I would like to make is that with respect to testing and symptoms, it would be really helpful. It's really essential that our students who have symptoms contact Shifford Health Center. I think there's some sense out there that there may be some repercussions associated with student conduct, but in fact, we do not do that. There's contact tracing, but if you test positive, you're not going to be investigated for how you acquired that disease, other than what is necessary from the public health perspective. Student conduct does not go back and look and then hold people accountable for past behaviors. We are very strict on what is happening at the moment. So if we see a party that is where distancing isn't being followed, people aren't wearing masks, we're going to break it up. There's no question about that. And there could be student conduct repercussions for those individuals that organized that party or attended it. But the retroactive work, we do not spend our time on that. It's all focused on public health. So if you do have symptoms and you are concerned, or you think you've been in contact with someone who's positive, just call the Shifford Health Center. We have a new helpline. So if you need to, if you can't get through to Shifford for some reason, although I think that's going to be easier and easier, call the COVID helpline that we advertised yesterday. We're starting to get calls on that, and that I think will take the pressure off. But do let us know if you have symptoms. Don't ignore it. It's important that we understand and also be able to support you.
President Sands and Dr. Bissell, I just wanted to ask you if you can share some information about how positive cases are actually being managed. There are a couple different layers to that, quarantining in residence halls, availability on campus, off campus, and as well as our healthcare providers and doctors, hospitals, equipments. I know you both have touched on that a little bit, but I'm wondering if we can focus a little more on that.
Well, Dr. Bissell, do you want to start with that, and then I'll talk a little bit about what we do on campus?
Yes, every case, as I said, we do an investigation, and part of that investigation is as we put them into isolation, because that would be 10 days from the onset of symptoms or 10 days from the time of the positive test. We make sure that they have the resources, that they get the needs, that someone can bring them food or they can order food, so that they can cooperate with isolation. And we offer them the university resources, the Dean of Students office, to help coordinate anything that they might need while they're on isolation. And then close contacts, such as roommates, close social friends, housemates, those kinds of things, would be quarantined for 14 days. And the same thing applies. One of the first questions is, do you have what you need to get your food, to get this, to get that? And if not, do you need resources? And we'll connect them with the appropriate resources. they're all pretty technologically savvy, and they all do the online ordering and delivery and things. So I think for the most part, they tend to be in really good shape. And we also want to make sure that they have the emotional support and resources. And we very much try to destigmatize because we don't want someone to feel guilty about it. And we need to keep that public health trust. We need them to be honest with us as we're doing the contact tracing. And as Dr. Sands said, we don't want them punished because they got COVID. We want to make sure that they're taken care of, and we want to make sure that we're able to do the appropriate investigation around each of those cases. So that's really important. As far as healthcare, they have Shifford Health Center. They do have other options as well. I will say most of them, again, are not very symptomatic to very minimally symptomatic. We do stay in communication with the hospitals. And just as we saw in Radford, we're seeing in Blacksburg that the ER visits have ticked up a little bit with some symptomatic students. But again, not the hospitalizations. And, that's definitely something that we keep our pulse on pretty regularly. One of the messages we get out to students when they're feeling sick is, they see their fellow students who are minimally sick to not sick at all. And if they're starting to feel symptomatic and they start to question, wait a minute, my buddy barely had any symptoms and now I'm really feeling short of breath, or I'm really feeling sick, that's when you definitely need to seek medical care. We don't want them to not seek medical care with the assumption that I'm young and healthy, I should be able to plow through this. Certainly there are no absolutes in medicine, and somebody who is young could have a more severe course that does require hospitalization or treatment. But we want to make sure that they know, yes, if things are different and you are just not feeling well, you need to seek that medical care.
I think you covered it pretty well. I think our Dean of Students office and our case management team are there to support as well. So we try to call everyone who lets us know that they're in quarantine or isolation, or that we have on campus in quarantine or isolation every day, just to check in, and certainly making sure that they have access to food and whatever supplies they need is a priority. So we'll continue to do that.
And I know, Dr. Bissell, that you mentioned what you've seen at other universities in the area, but I'm just wondering, and Mayor Hager-Smith, there may be things from other communities as well, but I just wanted to ask if there are lessons learned in other communities or other areas that you've seen that are helping to guide decisions for the New River Valley, and in what way?
Noelle, do you want to take that?
I think it's really important to understand, that what we're seeing right now is not what's happening right now. The numbers now reflect what happened, days to weeks ago. And so we have to be prepared that if we see an increase, that reflects what happened before, and not necessarily panic and overreact thinking, oh my gosh, this is happening right now. I like to tell people that the numbers on the dashboard, again, on the VDH dashboard and the VDH numbers, by the time they hit that dashboard, my team has already started the investigation, in most cases completed that investigation. So if there is a public health concern, you're going to hear about it before those numbers actually go up on that dashboard. So there is that, that time difference there. The other thing to remember on the VDH dashboard is that the numbers are cumulative. So it's not that that's the number of cases per day. And that a jump in one day is definitely not the number of cases new per that day. There are a lot of things that go into data reporting. We get lab reporting from Fralin. We also get lab reporting from Quest and LabCorp and other private labs. And we don't get those all at the same time. So as those cases come in, and then we do our investigation, as I've said, the investigation is absolute priority because we do a risk assessment and we do our containment and mitigation efforts before we do the data entry. So sometimes there's a little bit of lag in the data entry too. So, I think the biggest thing to learn is, again, it goes back to the epidemiology of the pandemic and the expectations, and, that we don't want to overreact and panic, and we don't want to underreact. So we are very attentive to that risk assessment and where that is. And we're ahead of what the posting of the numbers is in that regard. And if we see a red flag, we're going to be on it.
Dawn, you asked whether we are learning lessons from other communities, and I will tell you, I take my wisdom from Wakanda. And so we are in this very tender moment when we have been protected and we have taken care of ourselves, and we are entering that moment when we are going to start interacting with the student populations in the New River Valley. And I think we can go forward with confidence, but it has many of us feeling anxious. I just have to acknowledge that.
Yes, I think that's exactly right. And we do stay in close contact with peer institutions around the country. I'm in daily contact with my peers around the ACC, and we look at land grants, and we're in contact with them because they have similar demographics often. And their towns are often similar. So we are studying we're learning from those institutions. Some really interesting things that we've learned. You have to be careful when you send students home. That doesn't always make sense. You got to be careful with that. Sometimes it does, but sometimes it doesn't. You have to look at it holistically. Going online is helpful in some respects, but it isn't the solution because you're in a situation where most of the students are still in town, still around the community. It may be a good decision in some cases. In other cases, it may not have much effect on the course of the pandemic. We're also learning from some institutions that testing isn't the panacea. I think we took a pretty aggressive stance with respect to testing at Virginia Tech, as Dr. Bissell will tell you. She pushed back on some of our plans, and we did compromise and try to look holistically, and that's why we try to serve the regional health districts as well as Virginia Tech and Blacksburg. But I'm looking across, and we're seeing data coming in from other institutions around the country that are really altering our thinking and having us double check: are we going the right direction here? And if we are not, we will make an adjustment.
I feel mindful that we are a community of scientists and engineers and physicians, and we are well suited to get through this with the science that Noelle is custodian of and shares with us.
There's this thing called the heterogeneity of susceptibility. And what that means is that not everyone is equally susceptible to this infection. There's some genetic components to it, but there's also the behavioral components to it. One of the things that tends to lead, or contribute to the fear is the uncertainty. And Bill Flattery of Carillion brought up a very good point, the feeling of a lack of control. And we actually do have a good amount of control of our risk and our susceptibility with our behaviors and our practices. And again, all of those public health measures are very, very protective. For instance, when we have COVID positive individuals, but they have been masked and the people that they've been around have been masked, we are not seeing that secondary transmission. So that's very reassuring. When people are practicing the distancing, when people are outside, when people are washing their hands, we see the result of that there is not that exponential transmission that concerns people. So people do have some control there. And I think in general in the community as well, there's a little bit of a natural separation. Our students' schedules tend to be different than our community schedules. So our community tends to be out and about doing things during the day, and our students tend to be doing things later. So there's a little bit of natural separation there. And people definitely can have that choice. The other thing is the choice to be able to go online. The students have that flexibility, and the university has done a great job with the staff as well, giving them that flexibility. So I think that's a big thing. And just with today's technology, if you don't want to go in a store, you can shop online and have home delivery or have curbside pickup with restaurants and stores. So we can do more than we think to control that risk susceptibility. And we all have to assess what our level of risk taking is, but we do that every day and we don't think about it. but we do every time we get in a car, every time we do things, we make an assessment of what the risk benefit is. And it's no different here. And people can take some control. And I think that can help ease the that uneasiness and then anxiety over things too.
I think that point about personal choice is really important, and not just in the degree to which you feel like you are willing to be exposed or not, but in terms of the way that we develop policies and respond to the pandemic at the university. As Noelle mentioned, the faculty and instructors had the option this summer to decide what mode they wanted to teach in. And it was interesting to see about 7% of our courses are in person, about 30%, give or take, are hybrid, so partially in person, partially online. And the remainder, the vast majority, are online. And that was based on choices that instructors made, respecting especially the kinds of instruction that can't be done easily online. And so those are compromises, but they're also choices. I think it really does come down to that we all have our responsibility to make the right choices. We should make them for ourselves, but we should also have the greater community in mind when we do make those choices. One thing that I think is fascinating is that of our 37,000 students this fall, and that's including graduate students and in all of our sites across the Commonwealth, most of those, of course, are in Blacksburg. 11,000 are virtual this year, all virtual. And that was a typical number, might be more like 1,000. So 11,000 students have decided that online is the way to go. Some of them, have difficult decisions to make because they may have an experiential type class that really needs to be in person, and that's constraining them to some extent. But those that decided that they wanted to be all virtual, for the most part, had that choice, and we're seeing that play out in the numbers.
Mayor Hager-Smith, I wanted to go back to something you touched on earlier. You were talking about the task force and how very early on the town and Virginia Tech and the health department and a number of other partners were all working together to work through this pandemic together. Can you talk about that work? I know the Be Committed, Be Well campaign, we each had our masks for this. We see the buses going across town and the videos. Can you talk about that ongoing work and the efforts and how that will continue?
Yeah, the Be Committed campaign is the most visible example of our success together, I think, in communicating. With Virginia Tech's help and resources, we have pushed out tools for social media and posters and masks, almost 200,000. And we're sharing them with people throughout the New River Valley. That's 4 counties and a city. We are putting that in the hands of people who might otherwise be scrambling to try to come up with their own materials. But I hope that you'll see those things widely. And that's just one example of how we've worked together. There are 2 or 3 other things that I think are notable at this moment, because we are starting to transition into what can we do next? We've done all that we can. People need to keep themselves safe with common sense practices. What else can we do? So we have created a student ambassador program, and it's being staffed by Masters of Public Health students from Virginia Tech. And they are going to be out in the community sharing advice, sharing masks, and just helping to be advocates for the students and for good practices. We also have a program called Blacksburg Delivers, and the soft opening for that is going to be Monday. No, that's wrong, Tuesday after Labor Day, this coming Tuesday. And the next week will be a kind of fun and high visibility rollout. And Blacksburg Delivers is a program where 14 restaurants from Blacksburg will be providing food twice a day in a couple of locations. Let me think here. At Daring Hall and at Lytton Reeves Hall, there'll be deliveries at 11 and at 2. And there's going to be a special portal to make it easy to order food. That's in addition to dining services and in addition to food trucks on campus. We want to make sure the student population gets fed and that they're happy with their food. We also have a business continuity team that's formed, and that's being administered through our regional planning commission. And that's for the unfortunate business that is hit by a positive COVID case. What kind of funding can we direct your way to help you get the place sanitized, to help you restaff your printing business or whatever it is? So we're looking at the student population, the business population, everyone, what their needs are and how we can continue forward in the direction we're going, which we have confidence is the right direction to go.
And I just wanted to ask you, and I'll ask everyone this as well, Mayor Hager-Smith, as we head into a holiday weekend, can you give us your final thoughts on the work that's being done in our community, but particularly as we head into a holiday weekend, your best advice for people in our community?
Yeah, thank you. This is a weekend when we would frequently have a football game. We might be seeing sort of over the top behaviors. I hope that won't happen. We all know that's dangerous to us. To students, I would like to invite you to think of me as the face of Blacksburg, and not because I'm the mayor. I'm the person you look through when you're in the aisle of Kroger's. I'm the person you push past on the sidewalk. I am medium build. I am medium height. I have silvering hair. I'm a middle-aged woman. This community is full of people like me, and I want to live to see my kids prosper and my grandchildren grow. The town is full of people with connections that matter, with rich lives and imaginations, people of diverse accomplishments and resources. And we're united in our wish to see you succeed. We stand ready to help. That really, I hope, is the message going into this weekend and beyond. To members of the whole community, we've worked for 6 months to get to this place. Our numbers have been quite low. Our practices have been exemplary. Outbreaks have been contained. The regionalism and cooperation on display are unprecedented. But in the next 2 to 3 weeks, and especially this weekend, they're crucial. I want to ask the question of everyone: who holds you accountable? Those people, they're your community. And a healthy community holds its members accountable while also providing the tools for success. So we have that here in Blacksburg, all of the conditions for success. The results that other colleges and universities are getting are not what we expect for ourselves. Blacksburg is not every town, and Virginia Tech is not every university, and you are the students that we love. We're coming into this stretch with real strength. And if we don't succeed at this point, it's because we threw it away. We threw away the opportunity. Let's show the world what we're made of. Let's show them that this can be a success. Let's get this right, and let's be a model for how to do it right. Go Hokies.
Thank you, Mayor Hager-Smith. Dr. Bissell?
Yeah, I want to echo that this is about individual responsibility to take care of our community. And it's everybody in our community. It's those who live here, 12 months. It's the students who come. It's the students who are here even through the summer. That collectively, our individual actions are going to direct the trajectory of disease in this community, and we can affect the transmission and keep it contained. Mayor Hager-Smith said about all the things with the task force, and I just need to echo that the task force is every locality. It's our law enforcement, it's our first responders, it's our hospitals, it's our mental health, it's both universities, and they have all given tremendous support to the health department, the public health response in this community, and come up with some very unique programs and outreach. And my focus has always been those high-risk populations, so we've reached out to those folks, our nursing homes and our jails and the universities and our congregate settings. So I really think we are tackling this from every avenue. And now it's up to all of us, and we can't let our guard down. When we call somebody with a negative test, it is one point in time and they say, yippee, I'm in the clear. No one is ever in the clear. We have to be diligent and we have to be responsible, whether it's at work, whether it's at home, and whether it's at play. And we'll get through it if we do that all together and take care of each other.
Thank you, Dr. Bissell. President Sands?
I thank you for those messages, Mayor Hager-Smith and Dr. Bissell. I would just like to just comment that I think this is a generational challenge that we're facing. And maybe you could say the biggest challenge we've had in a couple of generations. And to our students especially, this is not the way that we're used to living. This is not the way it will be in the future. But I really respect our students and our faculty and our staff and our community members for the way that they've taken this challenge on. I think it's incredible. It makes me really proud to be a resident of Blacksburg and a member of the Virginia Tech community as well. My wife and I have been here for over 6 years, and we love this community. I wouldn't want to be anywhere else. The students, their commitment to service, to being in community, which is extraordinary at Virginia Tech. It stands out as one of our features. We do support each other. We want to be around each other. And yet we're in a situation where we can't be around each other the way that we're used to. Thank you for all the work that you have been doing for everybody listening. We've got much more to do. This weekend is going to be a challenge. Ideally, no one would travel. Ideally, everyone would stay in their pods, have fun, but keep it to your pod, keep it to your family group. Enjoy the outdoors, have a relaxing weekend. If you are in a position where you must travel, and I'm certain that's the case for some, please come back with the idea that you may have been exposed. Be careful for a couple of weeks. Quarantine if you think you have been possibly exposed. Stay in touch with your symptoms. And I think then we'll have a successful fall semester. But mainly my closing words are just thank you. I think extraordinary community to belong to, and really appreciate the partnerships that I think are exemplified by this panel that I think are unique in the country, to be honest.
Thank you, President Sands. As well, thank you, Mayor Hager-Smith and Dr. Bissell. I appreciate all of you speaking with us today, and thank you to everyone watching. Don't forget that you can find the latest information on the Ready website, which you can get to from the university homepage, which of course is vt.edu. We'll keep that posted as well for any upcoming webinars. So thank you all.